What are flow limitations in CPAP data? Have you ever wondered why some nights feel more restful than others, even when you are using your continuous positive airway pressure machine? One key factor could be flow limitations. So, what exactly are flow limitations in CPAP data? Flow limitations refer to a partial narrowing of the airway during breathing. This means that while you can still breathe, the airflow is reduced. It is not a complete blockage, but it makes breathing more difficult. This condition can happen when the airway is narrowed enough to cause issues, but not enough to result in a full pause in breathing, known as apnea, or a significant reduction in airflow, called hypopnea. In the context of sleep apnea and CPAP therapy, flow limitations are detected by looking at the airflow patterns recorded by your CPAP machine. When flow limitation occurs, the airflow curve changes shape, often flattening out. This indicates that your airway is partially obstructed. As a result, you may need to exert more effort to breathe, which can lead to frequent awakenings during the night, even if your apnea-hypopnea index is low. Flow limitations are important because they can lead to respiratory effort-related arousals. This is when you briefly wake up or shift to lighter sleep stages due to the increased effort needed to breathe. If these flow limitations worsen, they can develop into hypopneas or obstructive apneas, where airflow is reduced significantly or nearly completely blocked. Identifying flow limitations in your CPAP data is essential for optimizing your therapy. If you notice persistent flow limitations while using your CPAP machine, it may be time to adjust the pressure settings. In some cases, additional interventions might be necessary. For instance, positional therapy can help if flow limitations are more severe when sleeping in certain positions. Trying different mask types or even advanced devices like bilevel positive airway pressure machines can also make a difference. Flow limitations are not just a concern for adults with obstructive sleep apnea. They can also affect children and individuals with upper airway resistance syndrome. In these cases, flow limitations may cause sleep disruptions without meeting the criteria for apnea. In summary, flow limitations in CPAP data indicate a partial obstruction of the airway that can disrupt your sleep quality. Monitoring and managing these limitations is a key part of troubleshooting and optimizing your CPAP therapy. By addressing flow limitations, you can improve your overall sleep experience and ensure effective treatment for sleep apnea and related breathing disorders.